Hey, you guys, we're back at it again with The Daily Show. I'm here with.
Linda Wahiri.
I'm going to be asking her a couple of questions. So, question number one is, why is the COVID response the most important issue for Texas?
Well, as I said before, my name is Linda Wahiri. I am a social activist, UTSA student / Texan. And as a Texan, I am directly affected by this. We all are directly affected by this. And quite literally, we are in the middle of a pandemic due to coronavirus. So it's important for us as citizens to see how our government will respond to this crisis and how they will prioritize our health. Because as you know, local social norms and political confederations will influence the way political leaders communicate with the broader population about policy choices.
Okay, thank you for that really good response. So, question number two, what are the core challenges surrounding COVID-19 responses and how would you address this issue?
Well, Texas has one of the highest cases at 2.58 million for COVID-19. And yet we have one of the least strict policies towards COVID-19.
True.
And why is that? Because the government wants to keep citizens happy rather than safe, or because it hurts the economy and they don't care about us as much. Governor Abbott was inconsistent and fluctuated between telling Texas to stick together and listen to guidelines such as wear your mask, stay inside, social distance. And then he undermines his own orders by supporting the reopening of businesses. The way I would address this issue is that, like he said, we should have a unified community and we should enhance care and services at the state level, just like California and New York did. We need to be able to find free COVID test centers. It is so hard for us to even try and get vaccinated for free or even get just a simple COVID test.
So I know we just talked about how you would address these issues. So what might be a criticism of your solution?
One criticism is that people think the primary focus should be Texans supporting themselves financially, or that businesses suffered the most and regeneration of them would enable individuals and by extension their communities to rebuild themselves. And that there needs to be a rapid transition back to status quo as soon as possible. Another one could be is that Texans think that the government is just interfering too much and that they should just be able to handle it on their own.
So in conclusion, Ms. Wahiri, how would you respond to such criticism?
As a Texan, I understand that the implementation of restrictive social distancing policies in states like Texas clash with strong social norms around the role of small government and individual freedoms. However, the balance of policies and the moral of Greg Abbott's narrative toward economic recovery efforts is at the expense of the health of citizens. As cases rose, he paused his reopening strategy, but remained pro-business. And I quote, this is what he said, "The last thing we want to do as a state is go backwards and close down businesses. The more we all follow guidelines, the safer our state will be. The more we can open up Texas for business." But how can we open up and follow guidelines at the same time? He made it clear that business and economic loss was a driving factor behind his decisions in coronavirus policies. But we must not downplay the health repercussions, and we must not prioritize our livelihoods over our lives.
Well, thank you so much, Ms. Wahiri, for coming on here today to discuss the COVID issue in Texas. Do you have anything to say?
Well, thank you for having me. And I just want to let everyone know that coronavirus is real. Wear a mask, stay inside, social distance.